Hi Kirsten, this is John. I reviewed your unit of instruction and found it to be flawless. I really thought that the way you put it together with the help of the professional version of Zoom was spectacular. I'm just going to go through each section as described in the template and tell you why I graded the template as I did. First, it says that the instructional problem can be corrected with education. The problem, as stated in the title, postpartum hemorrhage, maternal obstetrical complication, and that's going to be for the OB nurses. When there is a complicated birth, this is something that these nurses will certainly need and best be prepared for with the unit of instruction such as this one. You provide a clear course description using a hybrid format, giving the students weeks to prepare with assignments and reading prior to the simulation. Your unit of instruction is designed to build on the knowledge of the new labor and delivery nurse and to recognize and intervene appropriately during the occurrence of a postpartum hemorrhage. This is something that new nurses are going to want to know. They're going to be anxious about being in a position like that and how they might respond, and this is the type of educational unit that is helpful to them. The fact that you're using a high fidelity patient simulation in a team scenario has proven benefits in improving knowledge, skills, and attitudes of both new nurses and experienced nurses, so that was very well done. You introduce yourself, state your availability so that the students know that if they should have any questions, you are easy to reach. This is a nice graphic picture of what normal postpartum condition would look like and what might lead to serious complications. You clearly list course outcomes, demonstrate proper knowledge, recognize risk factors, and then also how they will be evaluated. Your Voki was great. I had no problems viewing it. Okay. Next we go to the assignments on your to-do list. We review a case study prior to the class and review articles on postpartum hemorrhage. We look at protocol resources and videos that are all provided in the resource section. Here they are here. Okay. And I really enjoyed these videos from a list of case studies and this nice graphic presentation here. Next, you provide a discussion question that's more like a case study, and where the question, it's a very good question, it gives the learners an opportunity to reflect on what they might do with this new knowledge. Okay, again, right here you have a nice video, a nice graphic, and your PowerPoint overview is focused and points to the problems again with postpartum hemorrhage. In the wrap-up, you reviewed what you learned, the physiology, the clinical symptoms, the interventions and treatment, and how to function as part of a team in a postpartum hemorrhage in a high-fidelity scenario. And you encourage the learners to put their learning into practice and to work as a team and to seek out resources when they realize that they are having an emergency, or if they have any areas that need reinforcement or practice, which we know is very important. You ask them to let you know that, and that's the type of education we want. We want somebody who is open to issues as they occur. In your evaluation rubric, it depicts various levels of understanding and participation, starting with lack of participation to being an active participant. I've noticed in simulations that there are definite leaders who take charge of the situation, and there are those that stay off to the back. Given the opportunities to switch roles, those students might find themselves more talkative. As instructors, we can rotate those leadership positions during the scenarios. Active participation in the simulation and development of their discussion questions and the application of the knowledge. So that was very good. The quiz, I didn't do so well. I got 70%. I messed up with one of the first questions here. The labor and delivery nurse should do a pelvic exam. Well, I guess not right away. But I'm sure that if I had a remediation, I'd get 100%. In your reflection, was very thoughtful, asking the learners to look at what they have learned and how it's going to enhance their understanding of postpartum hemorrhage, asking them if they are more comfortable, that they have the knowledge, and if they feel that their teamwork skills in the emergency have improved. My experience in simulation is that they improved greatly. A little education and some instruction, and again, they improved greatly. So I'm sure that you'll have the same experience as well. Okay, again, in the student reflection, did you ask, did your scenario help bring the curriculum to life for you as a nurse? So those are some great questions. I see you added your self-reflection on the unit of instruction. I see that you got fired up about teaching. The technology is very user-friendly. I enjoyed Screen-O-Matic, and I'm glad to see that you'll utilize it in your future teaching. So that's my technology challenge for this week. I'm very happy to have had the opportunity to review your unit of instruction. Like I said, it was exemplary, and it helped raise the bar for me as well. So good luck with the class.